Here we have AP views of both humerus in 60-year-old with history of MGUS, and the skeletal survey was done to look for any lytic lesions. So what we have got here is this fairly well defined triangular shaped area of lucency in the lateral aspect of the humeral head close to the greater tuberosity. On the left side also we can see a similar lucency which is slightly larger and slightly ill-defined. These lucencies should not be mistaken for lytic lesions, and these are common findings especially in people with osteoporosis or over the age of 50 or 60. So these are called pseudocysts of the humerus, and this is a normal variation, and these should not be mistaken for lytic lesions and should not instigate for further unnecessary MRI scans. So to dig slightly deeper into this topic, these are not true lesions, these are normal variations. These are more pronounced in people with chronic rotatory cuff pathology, but most of them are asymptomatic. The pseudocysts appear because of relative lack of bone density compared to the rest of the humeral head. They are commonly located in the lateral aspect of the humeral head close to the tuberosity. The location is very, very important in this case to make sure we diagnose this as a pseudocyst. So in summary, here I have shown bilateral symmetrical pseudocysts in the humerus in suspected multiple myeloma.